healthcare in Washington State is our main focus today. And then we'll follow it up with some short team reports if we have any. Okay, so with that, I'd like to turn it over to Linda, who is our experienced and advocate for women's health care and reproductive rights, with a long history of being in the battle for that and still in the battle. So it's appropriate that she be the one to introduce Angela, and since she's been working on putting this program together.
Well, I think a lot of you already know Angela because she's been very active with the League of Women Voters and also the 2020 program, Citizens for, I just forgot what it is, Citizens for Healthcare Access. And she and I were active in that together for a while, and I was also in the league with her, but she's been especially helping the league this year with the U.S. caucus, the league's U.S. Healthcare Caucus and the Rural Caucus. So she is really up to date on everything that's going on in the legislature and also with the Congress. Here is Angela. Take it away.
Thank you, Linda. As Linda said, I am active here with the League of Women Voters Jefferson County. At the Washington State level, I am part of the League of Women Voters of Washington Healthcare Affinity Group, which then sucked me into the League of Women Voters U.S. National Healthcare Caucus, which has then sucked me into a rogue group, shall we call it, of League of Women Voters members and PNHP members looking specifically at rural healthcare needs and finding ways to make sure that anything going forward on single payer and anything going forward at the federal legislative level takes into account the unique situation in rural counties. Things like small public access, critical access hospitals and that sort of thing. So I guess that's five healthcare groups I'm currently sitting on in terms of my meetings. And I'm here today to talk about the Washington State Legislature. And so I will share my screen. Linda and I had some back and forth on various bills of interest, and as I went through what passed and what didn't, I noticed some trends that I want to talk about to help inform how to push things forward, because there are still a number of bills that we care about and finding levers to pull them out. I'll start by saying I sent Gina a document that's a shorthand of how the Washington State Senate Rules Committee functions. There's a white sheet, there's a green sheet, there's a pink sheet, and there's an X file. And basically it's a behind closed doors horse trading on what makes it to the floor and what doesn't. That's a very simplistic perspective, but looking at these three first bills that many of us cared very deeply about. So right now, I guess I should say I'm speaking with my Citizens for Healthcare Access hat on and my rogue League of Women Voters National hat on, because these are not my League of Women Voters Jefferson County or Washington. So I get too many hats. So this is just Angela speaking, not on any official capacity for the state of Washington League of Women Voters or Jefferson County. The first bill, this was the Keep Our Care Act, making sure that mergers and acquisitions went through some sort of process to make sure that healthcare would not be lost, that healthcare options would not be lost. What was interesting to me as I looked at this, seemed to be going through just fine, but when things pass out of their final committee, which would be in this case Ways and Means, they go through the committee with either a do pass recommendation or with no recommendation. And a lot of that influences where they rank when it gets to the Rules Committee for whether or not they get to the Senate floor. So this passed out of the Democratic-controlled Ways and Means Committee without a recommendation. The minority said distinctly no, and there was no recommendation. So it basically sat on the white sheet, which means it was going nowhere. The senators who sit on the Rules Committee each get a certain number of what they call polls, which is to take something off the white sheet, move it to the green sheet, and then from the green sheet, it goes to the calendar after they've all voted on it. So there's a lot of strategic thinking that goes into what goes forward. This bill, in fact, these three bills did not get polled by the Rules Committee. So if you wish to complain about it, the link to the document, which I've sent to Gina, and I'm sure she's going to make available to folks, has the members of the Rules Committee on it. If anybody wants to say, hey, why didn't this one get polled? Why didn't this one rate being polled? Those would be handy questions to ask. Likewise, concerning access to reproductive health care services and gender affirming treatment, this one, interestingly, passed out of Law and Justice with a do pass recommendation. The majority said do pass, the minority said no, but it still ended up in the X file, which means it went nowhere. It never made it to the green sheet. It never made it to the calendar for a floor vote. So somewhere in their non-public deliberations, this one was let go. An interesting thing that I heard today as I was listening to another committee, there's a Senator Padden, P-A-D-D-E-N, and regarding a separate bill that he was talking about today, he said, in Washington, it's not necessary. In Washington, this bill isn't necessary. And I have to wonder how many of our state legislators bought into that supposition that, well, this is Washington. We've got good laws protecting reproductive health care. We've got good laws protecting this. We don't need these right now. The only way, of course, to know is going to be ask members of the Rules Committee and see if they put that forward. Linda, you have a question.
There, you're on.
You haven't called it what they finally ended up calling it was acquisition and mergers, right? This is the acquisition and mergers law?
Yes, the first one, yes. 5241, yes.
We actually had a presentation at Indivisible last year by Save Our Secular Healthcare. And so a lot of us already know that this is the law that would prevent mergers that allowed the bishops to determine what kind of treatment we had, and that's both reproductive health care and end of life. So I think it's really important that we know that we realize that this is the bill that would have put a watchdog or put some controls over these mergers. And why the senator said it didn't affect us when half of our beds are already controlled by the bishops, I do not understand, and I don't know why anybody would listen to him. So if you have, if you could give us, do you have the information about, you said he's Senator Patton?
That was regarding a separate bill that was likewise also discussing reproductive health care. And I'll get to him in a minute. My concern, however, with this, and the reason I brought that up now, is because there are, in my discussions with various people about this mergers and acquisitions bill, there were a number of people who said, yes, we need a mechanism, but this isn't it. And so there's that side of things. The bill sponsor, I heard from a separate staffer, was told that this one would pass. So a number of senators were very shocked that this one did not make it to a floor vote. People were under the impression that it would. Nobody that I've talked to today, yesterday, previously, understands exactly why this one didn't, because this one was, including Senator Van de Weg, said, he's like, wait a minute, that one didn't pass. And I said, no. And he directed his staffer to take a look at why that was. So he was surprised.
Okay, well, I had talked to his staff and was reassured that it was doing well and it was likely to go forward. So this is a big surprise to me, and I'm sorry that I went backwards on the.
Oh, no worries.
Yeah, since we actually had two presentations on the what used to be Keep Our Care Act. Last year we had both the Save Our Secular Healthcare presentation, and then a month or two later we had a presentation from Dr. Case Colt, the commissioner, on what it would mean here in Jefferson County. So we actually have a lot of information, and I think a lot of our members, including those who are not here now, had that information and would have taken the actions that we recommended in our newsletter.
Okay,
So,
Linda, I'm gonna ask you maybe to hold some of the questions till the question and answer period. I know I, for one, don't remember a lot of that stuff that I know we saw. So, Angela, you want to go ahead?
Sure, thank you. So basically, these three bills, which many of us cared about, all ended up being killed by the Senate Rules Committee. So in seeking responses on what went wrong, the Senate Rules Committee is going to be the place, and I have conveniently put the link to the list of staffers here in the document, which Gina has and can send around to folks. Two bills that never made it completely out of committee. HB 1035, prohibiting healthcare entities from restricting certain healthcare services by healthcare providers. Never left House and Wellness. So this bill 1035 was that doctors, a hospital could not forbid a doctor from talking about reproductive healthcare services that included abortion. It could not forbid a doctor from talking about end of life, death with dignity. This was proposed to make sure that the Catholic-owned hospitals were not forbidding their doctors from talking about certain things. This never left the House Healthcare and Wellness Committee. So that's where that one got stuck. Then SB 5260 and SB 1286, protecting and assisting Washington employers providing access to or benefits for reproductive health care services, never left Senate Labor and Commerce or House Labor and Workplace Standards. These were the bills protecting employers from Washington state with employees in other states like Amazon, like Google, like Boeing, and that sort of thing, from prosecution by states where abortion is illegal. So if a Google employee traveled to Washington for an abortion, Texas could not come after Google in Washington for doing that. That never left committees. I have no idea why. I was not deeply paying attention to these until I saw them going nowhere. So that's where those two sat. We now go on to two bills that need a committee hearing. So the bills that are in play now have passed their House of Origin, and are now in the other legislative house. So Senate Joint Measure 8006, requesting that the federal government create a universal health care program, passed the Senate, 27 votes to 21. On March 8th, it was read on the House floor. It was referred to House Health and Wellness. It does not yet have a hearing date. Now, for it to go further, it needs to have a public hearing, and then it needs to have an executive session, and then it needs to be sent to rules. So the two that are in this on this page have 3 steps before they will get to a floor vote. Likewise, 5103 concerning payments to acute care hospitals for difficult to discharge Medicaid patients. This is a bill that rural hospitals cannot afford to lose. Right now, at least half the beds at Jefferson Healthcare at any given time are occupied by people who are waiting for a skilled nursing bed. Because the person is no longer categorized as needing acute care, the hospital is not being reimbursed for these patients. So they're stuck in this non-reimbursement limbo. So you basically have a staff of nurses caring for people, and the hospital is not being reimbursed by Medicaid for this. This passed the Senate 49-0. Everybody's in favor of this bill. It got a first reading and there's no hearings on it. So this is another one, particularly for those who care about keeping their rural hospitals solvent. This is definitely a bill that could use some pushes to get going. We now have some other interesting places. I guess I'll go to other. Big favorite of a lot of folks, HB 1155, also Senate Bill 5351, addressing the collection, sharing, and selling of consumer health data. This is all about safeguarding reproductive health. It is all about safeguarding your personal biometrics from being sold to companies. It prohibits a geofence to track and collect data from people who enter certain healthcare entities. I guess most people don't realize that if you have certain things on your phone turned on, your phone can tell when you go into a hospital building. It can tell when you go into a clinic. And that data, that metadata that resides in certain apps can be sold to folks right now. This passed the House 57-39. It had a hearing today at 10:30. Now that was its first public hearing. So this is good. It had a public hearing. It next needs to be put to an executive session for a vote. Then it would go to rules. So we still have 2 steps to get this one forward. The Senate Law and Justice Committee needs to have an executive session and vote to move this to rules. So were I going to sit down tomorrow morning, I would be going on to the legislative website, tracking down the majority leader's name and email and sending an email saying, hey, put this in for a vote. Likewise, SB 5242, House Bill 1115, prohibits cost sharing for abortion. That has a hearing on March 17th. I would encourage everyone to pay attention, to go in and vote, go in and register yourself as supporting this bill, particularly regarding our own Mr. Theringer, who is on the House Health and Wellness Committee. The final category we have is 2 bills who have passed their current hearing and are in Senate rules. As we learned at the very start of this, Senate rules is where 3 of our favorite bills died. HB 1340, SB 5400, that had a committee today, that had a committee meeting at 8 a.m. And this is where this Senator Mike Padden urged everyone to vote no. He said, this isn't going to happen you know, if you provide gender affirming or reproductive health care in Washington, nobody in Washington is going to sue you. Nobody's going to come after you. This is a big nothing that doesn't need to be focused on. That was his little speech at the end of the executive session right before the vote. So, like one of the other bills, this bill passed to the Senate with a do pass vote. The majority said do pass. There was one dissenting vote, this Mike Padden. It is now going to go to the Senate Rules Committee. And now we're going to depend on someone in the Senate Rules Committee to decide that this is the most important bill to pull. Again, I've given Gina the link to the members of the Senate Rules Committee for folks to take action on. Likewise, increasing access to the provisions of the Death with Dignity Act. This is the time frame. I think it takes it down to a week. This passed the Senate 28-20, and in a March 10th health and wellness executive action, it received a do pass, but it also had minority votes against it. So this is another one where pressure on the Senate Rules Committee would be helpful to get it moving. Because again, in the Senate Rules Committee, we depend on the people who sit on that committee to say, hey, I'm pulling this bill. I am sure there is a Democratic caucus meeting that looks at the lists and says, hey, what are we going to pull? What are we going to advocate for? And when it comes down to healthcare, these are two very important ones to move forward. If I had to rack and stack my personal choices of bills, these two would be on the list, as would HB 1155 and SB 5103. So basically everything on the list matters. We know this. The consumer health data could literally be a matter of women's lives, particularly, and women's welfare and well-being in states where abortion is not legal, keeping our rural hospitals afloat. This Medicaid bill, SB 5103, is going to relieve a lot of financial burden. If our rural hospitals stay financially solvent, they're less likely to be taken over in a big merger by a Catholic hospital. So that's my short list of everything that's going on. And I see that Bruce has a question.
On 5103, that's that discharging hard to discharge patients bill,
Yes.
which is alive. Does that cost the state money to reimburse the hospitals, or is that are they trying to get the federal government to pay for that?
That comes out of the state's federal, the money that the federal government gives the state to deal with for Medicaid. The Medicaid balances of what gets reimbursed for what have not been adjusted for a while. So that comes out of the state's allocation for Medicaid. So yeah, so it's a struggle. It is.
And I take Linda's point about the bills that seem to be dead for this session, but it is a 2-year session. And when those folks come home, we can talk to them about bringing them up again next year. Is that right?
That is correct. That is correct. Yes. So, you know, the mergers and acquisitions bill has been, I think this is the 3rd year it's been in play. So 4th time is a charm. Some version of it, looking at this. A lot of it is just getting it to the point. I have to be honest, I have never seen this many crucial bills coming through Washington State. And I sort of liken it to, there's a big flood coming at us from the east and the south, and Washington's trying to put up dams and barriers to keep us from getting overwhelmed by it. So there's been a lot of necessary action going on, much more so than in the past. Yes, Bruce.
One more bill I want to draw attention to, this medical, is the dental therapist bill, which passed the House and is now in the Senate. Have you been tracking that one?
I have not.
It creates a new category of professional provider who could do more than hygienists do. There's great training for them. It's under the supervision of a dentist. And it would it would really help a lot with Medicaid dentistry and people who can't afford to go to the dentist the way so many of us do.
Good to know.
I'll find the number.
All righty. So yeah, this is this is the list that I've largely been tracking for this. Before I go, I want to bring up one thing. PSARA, the Puget Sound activists group, is having on Monday on March 20th, they're having a speech on "Don't Let Naked Profiteering Destroy Our Medicare." I promised them that I would show this. You can just go to the PSARA website and register for the Zoom there. The link on the document that I have doesn't work. I had to go to the PSARA website. But yes, so this is a PNHP person talking about privatization of Medicare, which is obviously a strong point with many of us. Other things going on at the national level, just in general, is we're also looking at finding a way to get additional federal dollars flowing to independent, non-corporate affiliated rural hospitals to keep them solvent. The nice thing about that is, in addition to benefiting a lot of us in Washington state, it's a issue that cuts across the political spectrum, because the people in Wyoming and Montana, they like their little rural hospitals also. People in South Alabama like their rural hospitals also. So the initiative on this has members. We have folks from rural Kansas, we have folks from rural Georgia, rural Florida, upstate New York, all working together to try to find a federal way to provide support to rural hospitals so that they don't get bought out by the Catholic. In a lot of places in the South, it's the Baptist hospitals that are doing largely the same thing. So anybody interested in that, in being part of that national effort, it is not just, it's a rogue group of activists, PNHP, League of Women Voters, some hospital administrators and that kind of thing, looking to do that. So that's what's going on. Marilyn?
Stepping back from your official positions, can you talk a little bit about your feelings about the lobbyists and what they're doing to these legislative issues?
You're talking about the corporate lobbyists?
Yes.
Oh, they're drowning. They are absolutely just overwhelming. The corporate insurance folks are, again, as there's a guy who makes short little TikTok videos explaining how United Healthcare made $200 billion last year, in which he noted that when you make $200 billion, you can write the laws. I think it was only 20 billion. I believe he was exaggerating in his TikTok video, but United Healthcare did in fact make $20 billion in profits last year. And we're basically a ragtag group of activists around the country trying to fight that level of intervention. The Catholic hospital networks regionally and nationally coordinate their messages. I mean, it's overwhelming. It's overwhelming to the point that is just sort of staggering. Had a conversation with a hospital administrator in Minnesota who is one of the few independent public hospital districts there, and a big state grant to rural hospitals went to a Catholic hospital chain that had, 6 small rural ones and 12 urban ones. And that was a rural healthcare grant. I mean, it's just, the more you get into it, the more frustrating it gets. And all we can do is keep trying. Pat, you have a question.
You're talking about United Healthcare. I just read an article last night about their Advantage programs, not just theirs, but all these Advantage programs. But they bought out this AI program that is basically cutting people off that needs to go into people that need to go into long-term care after a broken shoulder or hip or whatever, they're not taking into consideration other health issues they have. They're denying them coverage when they still need to be in the nursing home. They're making billions of dollars off doing that. They might get overturned if that person has a wherewithal, if they don't die first, to fight it. But it's disgusting what they're doing. These kicking people out or kicking them off coverage for their long-term care. Not long-term care, but if you need 20 days instead of 10 days or 30 days instead of, what little they want to pay, so you can recover in a nursing home after surgery or whatever. And they're not following the Medicare guidelines. I mean, it was disgusting reading what they're doing.
Yes, and so further, the Medicare Advantage plans do not have to pay the critical access hospital rates that traditional Medicare pays. So in addition to screwing over the patient, they're also screwing over the small rural hospitals by underpaying the reimbursement rates because they're special. One of the tactics Medicare Advantage did down in Columbia County along the river, where there is one critical access hospital that is an independent hospital, several of the Medicare Advantage plans flooded Columbia County with marketing saying, oh, it's a simple form to add your doctor. Well, the problem is that United Healthcare did not have a contract relationship with the critical access hospital at all. So there's no adding anyone. So all these people fell for this aggressive marketing. The robocalls, the emails, the mailed in brochures were promised things that are not possible, and now find that they have to drive to Walla Walla for care from now until the next open season. I don't know how many of you know that United Healthcare did not renew their contract with Jefferson Healthcare. If you have a United Healthcare Medigap or a United Healthcare Medicare Advantage plan, Jefferson Healthcare is no longer a preferred provider, and because it costs too much to reimburse critical access hospitals. They might only make $19 billion in profit instead of $20 billion in profits.
Wow.
Not that I have an opinion on this at all.
Reading about somebody who couldn't get up, couldn't stand up on her own, and obviously wasn't ready to be out of a nursing home and being just cut off like that. It's just like,
and the problem is that so few people have advocates to fight for them. We need like a legion of volunteer Karens to go all holy hell on these insurance companies and make them do what they're supposed to.
And they wear out the patient. They wear out the doctor who's got to fight for the coverage for their patient. Yeah.
Linda, yes.
I'm still concerned about this shield law, and I think that's the HB 1340. Today's paper had news about a new lawsuit against people who had assisted a woman in getting an abortion, and they were using the wrongful death term in order to get their suits heard. And I'm wondering if we're not possibly looking at the same kind of problem coming here if we don't have a shield law in place.
Yeah, I mean, so that case is in Texas, which is its own special healthcare abomination. But yes, no, I likewise remain very concerned about HB 1340, and I personally will be emailing people in the Senate Rules Committee tomorrow saying, hey, I saw that because that was just this morning that went, get this on, and I've got this is the document I've sent, take it off the white sheet, get it to the green sheet, and get it to the calendar floor. For the floor. All those rules, Gina has it. But yeah, this is all of these need some heavy forward pushing by everyone who cares deeply to get that done. Nancy?
Do you know if there was anything that came up about addressing quality of care in nursing homes?
You know, I am not familiar. I'm not personally tracking any of those bills. I can see what comes out of on next Sunday, but I really don't know.
Okay, thanks.
Angela, can you give us any sort of summary on where Jefferson Healthcare is on opposition to mergers? Are they unanimously opposed?
Jefferson Healthcare basically had no comment because they intend to never be in the financial place to have that happen to them. Their big priority for this legislative session was funding for the construction that's going on, the expansion. That was largely their focus, according to the various conversations I've had with folks, is just making sure that their budget allocation was put in there. When I had a private conversation with Mike Glenn, he said they're not really worried about it. He can understand why some of the ones, particularly in poor areas, are worried. But because that doesn't apply to him, basically he really didn't have time or energy to focus on it. So they did not speak one way or another regarding that one.
Thank you.
Great questions. Other questions? Have we missed anybody? Well, that was a really, really in-depth presentation, Angela. Thank you, and very interesting. Okay, Marilyn?
Yeah, the April 11th meeting at Unity. The topic is saving energy and saving money. And this is a workshop program, but we're going to have some presenters who are going to be talking about how they saved energy and saved money. One of them has built a zero net house. We'll also have Jameson from PUD, who's going to tell us all about the rebates that Bonneville gives to people who are doing these upgrades to their homes. And these are delicious things. He says that our county is not amiss with these things. We have actually rebated as much as $1.5 million worth of upgrades already. So he's encouraging people to take a look at this and see what kind of home upgrades they can do to save energy and save money. And he's going to get specific about the rebates. There are other people from solar, representatives from solar energy, from Frederickson's Electric, who could talk to you about all the upgrades for electricity, things that you can do to your home and get a rebate for doing so. And
Like heat pumps and stuff?
pardon?
Marilyn, like heat pumps? Like heat pumps?
Heat pumps, electrical panels that need updating, electric hot water heaters. And he may also have a solar guy they've sort of branched out at Frederickson's into solar also. So yeah, a workshop where people can talk individually with these people about the pros and cons and what you might need and how you set up appointments and how you can do these. So it's kind of exciting. It ties into Earth Day on the 22nd. And it all has to do with saving energy. There you are, there's the poster. Rally, April 22nd, high noon. Bring your sign about the earth, about your love of the earth, about protecting the earth. And we'll rally right at the triangle. And if there are enough people there, and I think there will be, we'll march up and down Water Street with our signs, which is always fun.